Conversations with Iris. Here's your host, my loving wife, Iris.
Hola, mi gente bonita. Hello, beautiful people, beautiful souls, beautiful lives out there. Welcome back to another episode of this little podcast that Conversations with Iris, coming at you again. Fridays are fun days, and the show where we have just real conversations with incredible people who are out there challenging the way we think, the way we live, and the way we just grow. First off, I just want to say thank you, whether you're listening from right here in the United States or tuning in somewhere across the world. I want to thank you so much for continuing to listen to me, downloading me, sharing, and supporting this show. It is amazing. And of course, because I'm Latina like that, I got to brag. I got to hit you guys with that sazon, that pizzazz, and we're nosy like that. So I got to share with you the scoop that one of my good friends said to me. And I just have to share this with you guys because it just like melted my heart and made me happy. She told me that she looks forward for every Friday. I mean, that's amazing to me. She says she loves her Friday mornings because it gets her motivated to hear a brand new conversation that feeds her soul. And it makes her think a little bit deeper about life, her purpose, and the journeys we are all on, which are all different. But then again, they tend to fuel our heart and our soul. So thank you so much for the feedback, Andrea. I really appreciate that. I just wanted to give you a shout out because that meant the world to me. And let me tell you guys, today's episode is going to make you pause and think about something that affects every single one of us. Do you know what that is? Think about that. Dun. The dreaded healthcare. And let me tell you guys something, because the reality is this. Did you know that over 80 million Americans are making financial trade-offs just to afford healthcare alone, just to afford it? Did you also know that millions of us continue to delay surgery because we cannot afford it? Surgeries that we may need that may be life-threatening out there. And did you know that even people with insurance, even high incomes out there, are still struggling with healthcare costs? That's a lot. Think about those things. So the question becomes, think about this. What happens when healthcare system stops working for patients? And most importantly, what options do people actually have? Have you ever asked yourself that? Because that's a very convoluted, important question for you out there. Think about that. Today's guest is someone who decided to just challenge the entire narrative about healthcare. I just love what he's doing out there. Our guest is the founder of Sylk Health, the first platform that allows patients to see real prices for nearly 2,000 medical procedures at accredited hospitals in China, right next to the US prices. I mean, we're not talking about no forms, no phone calls, just full transparency. He gives you the nitty gritty, okay? That 411 we need. After studying medicine and later experiencing the healthcare system from a patient perspective himself, he built Sylk Healthcare. After watching a close friend lose her job, she lost her insurance and the access to treatment she desperately needed. He was like, I got to do something about this. So today, his platform just helps so many individuals out there explore healthcare options that can cost up to 70% less than in the United States, while still meeting international accreditation standards, which is amazing. And I love how he speaks on healthcare, policy, entrepreneurship, and global healthcare access, and the controversial but growing conversation about the medical tourism and cost of transparency. So without further ado, please help me welcome to Conversations with Iris. Bienvenidos, Adam Cunningham. Welcome.
Thank you very much. It's a pleasure to be here. I really do appreciate the introduction. I feel like I could be a WWE wrestler at this rate.
And don't even get me started because I love wrestling, okay? I'm not even going to go down that aisle there. But yes, I told you I'm going to make it sound so good. And you're a celebrity. We're going to talk about you. We're going to give you your flowers. You know how I do.
No, I appreciate it. Thank you very much.
Oh, you're welcome. And where are you tuning in right now? You got to tell our guest or our listeners out there.
Right now, I am in Nigeria, in Ibadan. I'm doing some volunteer work at a hospital here, and sadly managing to get myself sick in the process.
Oh my goodness. Nigeria, all the way from Nigeria. So what is the time zone over there? Is it like night already?
Oh, it's almost quarter to midnight here at this
Wow.
particular time.
Oh my
It's all
goodness.
over the place. I'm talking with people in China. I'm talking with people in America. I'm talking with my family back home in Australia. So we're all really all over the place.
Oh my God. I just love it that you're tuning in from Nigeria. Let me tell you something. I love African culture, food, the vibes. I love what you're doing out there, Adam. And before we get started, I want to start out with a quick, icebreaker. I want to ask you something and I want you to get real with me. What's that one thing about healthcare system that you would magically fix? Something overnight, like no politics, no red tape. What would you change first? Can you tell us?
Rent seekers, and rent seeking behavior. It's pretty simple what healthcare is, right? You've got sick people and you've got people who want to help sick people. And for the most part, that should be a fairly simple objective and a fairly simple process. But sadly, the reality of it is that there's 1,000 different parasites in between the patient and the person trying to solve their problem.
Oh my goodness, that's crazy. That is crazy. But I'm glad that you brought that up because it's true. That is something that we need to take a further look at and see what we could improve in, right? That's definitely, we need to talk about that more in our life, in healthcare, period.
Oh, I'd certainly say we need to talk about it more, but what's more important is actually doing something about it.
Yeah. Yeah. I agree, definitely. And Adam, let's go back to the beginning because I want people to know who you are. I mean, you studied medicine and then you found yourself experiencing the healthcare system as a patient yourself. It's something about when you are in the other side of the spectrum. I'm in healthcare myself, and there's so many things that I didn't realize till I was a patient myself, and I needed that care urgently. That makes you think. That alone can completely just shift your perspective. So, what was that moment you realized something about the system just doesn't make sense? But I want you to tell us a little bit about who is Adam Cunningham.
Well, yeah, I studied medicine a few years ago, finished my degree, which was a quite involved process to say the very least. After graduating, I got quite sick. As a matter of fact, the reason why I got into medicine in the first place is because I have asthma. As a kid, I would quite often find myself seeing doctors or in hospital due to my asthma, and that's one of the primary things that prompted me to get into medicine in the first place. A bit of a naive idea on my behalf, I guess, considering that it's ended up with me not practicing medicine professionally. But once I got out of school and I started working a bit, I eventually got sick, and I found myself dealing more with the billing department than the actual hospital itself.
Wow.
And this was for some private care, given that I needed to get some things sorted out with my asthma. But even though, in the Australian system, for instance, it's quite easy by comparison, there's still some difficulties to it. And I was starting to become a bit more aware of them, perhaps from the patient side, when last year, I think around this time last year, I have a friend from Maine. She works as a women's advocate.
Oh, wow.
And she lost her job to the Trump budget cuts, the Doge cuts that happened a little while ago, which I'm sure many people are familiar with.
God. Oh, my goodness.
And in about the 6 months leading up to that, she developed very aggressive rheumatoid arthritis. Like the kind of rheumatoid arthritis that results in her not being able to do, the simplest of things, like picking up a pen and writing. That's a no-go. Drinking a glass of water, that's a difficulty. It's not as if it was just a small or minor inconvenience. And in between the time when she developed this really aggressive rheumatoid arthritis, and by the time that she'd lost her job and lost her healthcare insurance, she had pretty much spent about 8 months, maybe 6 to 8 months, just getting the runaround by her healthcare insurance.
Wow.
Constantly, like her doctors would say, oh, she needs this drug, she needs this prescription, she needs this treatment. And her healthcare insurance would get back to her and say, no, she doesn't. She needs something else. Try something else. Try something else. And by the time that, all the back and forth had been done, by the time all of the paperwork had gone around to, 10 different people who don't really look at it, she'd lost her health insurance. And now she works as a bartender with crippling rheumatoid arthritis, which doesn't really make any sense to me, and I don't think it should make any sense to anyone else for that matter.
Yeah.
The idea that you can be a taxpayer, the idea that you can contribute to society, especially as a women's advocate, for instance, and then be left to effectively fend for yourself, is ridiculous. And I know it seems like a bit of a stretch, but just a few hours ago, I was browsing through Instagram, and there was a video of a 90-year-old woman at some university hospital in the US who had literally been taken out by security. She was still in a hospital gown and everything, and simply dumped on the sidewalk with some bedding next to her.
Oh my God.
And that was only a few hours ago.
Mhm.
So it doesn't matter really who you talk to or which perspective you look at it from or what angle you look at it from. Healthcare in not just the US, but specifically or particularly the US, is not just broken. It's predatory. It's not designed to help people. Well, not to help people who need healthcare. It's designed to help people who make money off of it, I would think.
Yeah. Oh my goodness. And how is your friend now? Like, is she still bartending with her RA that's severe?
Yeah, she is. That's a mostly weekend gig for her now. And she's doing pretty well at it. But she's essentially using all the money that she makes from bartending to get treatment for herself. And it's certainly a difficulty for her. I have no idea how the hell she's managing, but she somehow is.
Oh my God. And thank you for sharing that story out there and for basically saying, to our audience that are listening right now that, hey, I'm a patient too. I have severe asthma. I've worked with the billing department firsthand a lot of times, your friend with RA. It's crazy. And you've been on the other side of the spectrum. I want to touch base on something you mentioned, and this is just because of my curiosity. And a lot of our listeners are from US, but we do have you listeners all across the country. Can you tell me what are those differences between the United States healthcare system and versus the Australian healthcare system? Are there any big differences that you could help us understand just because my curiosity is sparked?
Well, I'll answer that in a way. I was recently on another podcast talking to a policy advisor in the US, and we were talking about the amount of physicians in the US, the UK, and Australia. And quite often there's a perception or a belief that in the US, if you want to get healthcare, like you can get it, it's easy, it's accessible. You've just got to pay a bit of money for it. And to a degree, that's true, but I don't think it really tells the entire story. And it turns out in the US that for every 1,000 people, there are about 2.3 physicians. In the UK, there's 3.4 physicians for every 1,000 people.
Wow.
And in Australia, there is 4.3 physicians for every 1,000 people.
Wow.
And the interesting thing to take out of that is you never hear the end of how the medical system in the UK is overburdened, how it's constantly about to collapse because there's just too many patients and not enough doctors and not enough nurses. And I'm sure you've even heard that in the US.
Yes.
And I do not by any means believe that the UK is a less healthy place than the US. And it doesn't really matter what way you want to put it. The US life expectancy is less than the UK's. And it's decreasing. It's not going up, it's going down, which is quite absurd for a first world country. And so to answer your question in a way, the difference is that while you may have less doctors in the US, but people will still say that healthcare is accessible. The reason for that is because, or at least from what I can infer, is that people aren't using healthcare in the US. People simply can't afford to use healthcare in the US. And that is how you can get away, if you can even call it that, with 2.3 doctors to every 1,000 people, which is basically half of that of what we have in Australia. And even then, we don't believe we even have enough doctors. And you can make any inference about other medical staff as well. And so the point really comes down to it in the end is that people need healthcare, people are sick, people are quite often with debilitating illnesses and diseases and things like that. People need hip replacements, people need knee replacements, people need heart transplants, people need heart bypasses, people need cancer treatment, and they simply aren't getting it because they can't afford it.
Wow. And then you're honing in on something very important, the healthcare cost reality of it, right? As you mentioned. And thank you, Adam, for that analysis in comparison to the US, Australian, and also UK healthcare system. And it's always good for us to know that. I think it's very enlightening. But I want to shift and talk about the healthcare cost of reality of it. I mean, the numbers you talk about are honestly shocking. They really are. I mean, we have millions of Americans that are delaying, like you mentioned, surgeries because they simply cannot afford it. I mean, even with insurance, because we have that thing called deductible or out of pocket, all that good stuff. No. And this is the good one. We have prior authorization, the good old prior authorization, right? So, from your research and experience, why are healthcare costs in US so dramatically higher? I mean, compared to those other countries out there?
Because they can be. I think that's really the only answer to that query is because they can be. You can discuss it from several different points of view. You could say, well, it's because patients aren't taking things into their own hands. You could also say it because patients haven't gone around and pushed enough CEOs out of windows. It doesn't really matter which way you want to come at it from. The simple reality is that because they can, because a pharmaceutical company can charge $300 for a $100 pill or insulin for that matter, because hospitals can charge $700 for a bag of saline, which costs $1, they will, and not only will they do it, but they'll lobby it into law if they get the chance. It really is just a matter of being the strongest people or the strongest group around and making the world the way they wish.
And do you think most of those Americans out there truly understand the actual cost, like the differences globally? That's a good question too, because I feel like some of us are just complacent, like, okay, my hip replacement costs $17,000. I just got to get it done. Let's just do it. Do they really understand? I don't think people really understand.
It really is a peculiarity with the US. Back in 2021, I think it was, there was a new law introduced. I'm pretty sure it was under Biden's administration. And the law was essentially requiring the publication of procedure costs by hospitals. And every hospital in the country was required to essentially say, here's our procedures and here's a number next to each procedure. And that's it's law. And since then, 1 in 5 hospitals has actually complied with that law. So it's 21%. That actually do publish their prices, and the rest of them don't publish their prices. And you could say, well, it's not that big of a deal. Like the prices, they can't be that crazy. And the reality is that this lack of information, this obfuscation of information, is where the healthcare industry thrives. By simply not providing information to people, by keeping people illiterate, so to speak, they're able to be more easily misled or simply just not know at all. And by the same measure that, you'd argue that an illiterate population is easier to subdue or control or whatever it might be. You could make the exact same argument when it comes to healthcare. If people have no idea what the prices should be or could be, then they won't necessarily argue with them. They'll complain, but they won't necessarily argue with them and, really try and beat them down to what they should be because they don't know what they should be. And so the comparison of that would be, look at Europe, particularly Eastern Europe, look at Asia and places like that, where they don't necessarily have as encompassing medical sectors or government provided medical services as, say, Western Europe or something like that. But they still go out of their way to publish prices. Virtually any hospital that you look at in Eastern Europe will say, oh, okay, here's how much you're going to be charged for a particular procedure. You look at Asia, for instance, and the prices are right there on their website or whatever medium they're using. And they're not necessarily going out of their way to obfuscate prices. And so that's really what it boils down to, is that other people are able to get prices. And so prices are kept low because there's no fog, there's no shadow misting everything. Whereas in the US, nobody really knows exactly how much something is, and the evidence of that being that there's some recent CMS data talking about the variation of hospital costs and medical procedure costs in the US, and Medicare sets a standard price for any particular procedure, and generally you would expect like private healthcare costs to be like a small multiplier of that base Medicare cost. But in reality, these costs vary anywhere between 3 times to 30 times. And I'm really not joking or making that up to 30 times what the base Medicare cost is. So I really can't blame the average person for not knowing.
Wow. And let me tell you, I know all about that. I know all about CMS. And for those that don't know, CMS, we're talking about Medicare, that good old Medicare. And I'll tell you something, Adam. In healthcare where I work, we refer to Medicare as the black and white. It is what it is. They publish their rates, and that is what you're going to get. That is what a physician's going to get reimbursed. That's how much you're going to get covered. It's very black and white. They wipe their hands. That's it. No more. Isn't that funny how Medicare is? But then again, you have the private insurances out there, and you're absolutely right. The prices are different. They may be higher. I mean, we see that so much in healthcare and all those changes. I mean, we have United Healthcare, we have all those big ones out there, Blue Cross and Blue Shield. I mean, I could just keep going, right? Humana. I mean, it's crazy. It's just very, very crazy. So I'm glad that you brought that up, because I want to talk about what Sylk Health actually does. And we mentioned that a little bit in the introduction, because you built this beautiful platform that lists real prices for medical procedures at accredited hospitals in China. You mentioned that they're very transparent. They have their prices out there side by side, and you have them in comparison with US prices, which honestly is something we rarely see in healthcare. We don't see that. We need more of that, right? True price transparency. So explain for our listeners how the Sylk Health platform work, and will help us understand like what happens when someone actually decides to explore those treatment options through it.
Well, it works quite simply. As simple as, say, booking.com, for instance, when it comes to getting a hotel room or something like that. And that's really what we've tried to replicate, whether it's in the US healthcare system or whether it's in other medical tourism sites. It's really about the obfuscation of prices, like preventing people exactly from knowing what something is and then throwing on a bunch of add-on services in between. And so the way it works for us is that we have partnered hospitals currently in China, but we're actually getting quite a bit of interest from other countries and other hospitals.
Wow.
And the way it works is we have a catalog of procedures. So we define the procedures just the same way you might say as Medicare does. And then these healthcare providers select the procedures which they wish to offer, and they set their prices against those procedures. And that now acts as a catalog of that hospital that can be shown anywhere in the world. And so the way it works for the consumer or the patient is that you come on our website. I would assume you know the the procedure you're looking for by the time you come to our website. And then you can see all of the various healthcare providers that offer that procedure and their prices and their waiting times and any other information about their service that they might wish to share with you. And the entire process to make a booking with that hospital or hospitals takes less than 5 minutes. Frankly, you could do it in 2 or 3 minutes, but 5 minutes is pretty generous.
Wow, that's amazing. And building something like Sylk Health, I keep saying healthcare, Sylk Health, it probably wasn't easy, right? It really wasn't. But what were some of those biggest challenges or resistance that you faced while you're building this platform? And was there a moment that you ever thought like, oh my God, this idea may actually disrupt, something bigger than expected? Did you ever feel like that when you were building it?
Well, there's a lot of emotions, you might say, that I've experienced throughout the course of building this. A lot of it has just been shock, pure, unbridled, unmitigated shock that how the hell are people getting away with this? That's really been my continued experience for perhaps the better part of the last year is how come people are getting away with this? I'll have to write papers to communicate with other people and things like that. But, there's, I was on another podcast a few days ago talking to a healthcare insurance broker. She paid $67,000 for a hip replacement.
Ooh.
Out of pocket. I simply couldn't believe that. $67,000. Like that's a nice car. That's a deposit on a house.
Yeah.
And, for the same thing in China, you'd be paying like $14,000 at most. And that's
Wow.
like that's at a tier 1 hospital. That's like a fancy private hospital in China, 14 grand. And it's things like that I just don't believe. I don't believe like the crazy markups on different drugs and things like that. It's really just been a constant roller coaster of absolute shock. And the opposite end, or maybe not the opposite end, just another thing that I've been experiencing as of late now that we're getting traction is that there's actually a lot of other people who are very much on the same page with what I'm doing. Strictly speaking, what I'm doing is new. It hasn't been done before in the medical tourism field. But there's a lot of other people who are not just supportive, but are actually providing support, are actually going out of their way to help me, are actually believing in the mission that I'm on.
Yeah.
And for the longest time, it's been a bit of a battle of will, you might say. And now I'm starting to realize that there's an army of other people who are very well in agreement with me and who are coming to help. So it's been heartwarming, to say the least.
Wow, that's amazing, Adam. I'm so glad to hear that. And I'm glad that you're gaining traction and interest from other countries as well to develop something or to, who knows, partner with them. That's amazing. I think this is something that we all need, like as Americans all across the world, to be honest with you. I definitely want to talk about and shift about the medical tourism in China a little bit here because medical tourism has existed for years, but China isn't always the first place people think when we hear that term. They're not. Yet China, though, we hear so many great things among the top countries just for being the best when it comes to having accredited hospitals, clean, better health care. And I feel like it leads the world into certain advantages like therapies like better cancer treatments. I believe they call them what, cancer treatments?
Yeah, that's the gold standard.
Yes. So like I wanted to ask you in full transparency, what was the most shocking thing that surprised you the most when you began researching the China's healthcare system? Because I'm intrigued.
We're partnering with a group called United Family Healthcare, and they're a large private healthcare group in China. They have, I think, 15 different hospitals across tier 1 cities, and
Wow.
they do a lot of work with international patients and things like that. And the woman who represents them and that I liaison with. When I first approached her and discussed the idea of bringing a lot of Americans and Westerners across, she asked me the question, well, why would anyone want to come here? Well, why would anyone want to use our service? We're a very expensive hospital. We run a very expensive service. Like, yes, you could market us to very wealthy people, but
Yeah.
as a general thing, why would you do that? And I had to make the argument to her, basically saying that even with the most expensive treatments that you have, they still pale in comparison to what the average person is paying in the US. And it just wasn't something that she, or frankly many people in China, realize, is that the US healthcare system is, from a business perspective, it's an amazing opportunity from them, and from a humanitarian perspective, it's certainly something that any good humanitarian would want to offer their services towards. And so that's really been the biggest shock to me, is this international misunderstanding or misappreciation of just how bad things are for other people in the US. And I think that really comes from this relatively historical idea that the United States is the place to be. It's the richest country in the world, and everyone's super happy. The American dream,
It's
and
not.
things like that.
Sorry to break it to you.
and so that was quite surprising to me. And now that we've established what things are really like, they're all on board. They want to help. They're super hopeful and genuinely caring. And to move on a bit from your question, we traditionally have seen China as an adversary, for instance, and that might be true for governments when we need to talk about
Yeah.
things like that. But for the average person, such as myself, not at all. The people there don't care. As a matter of fact, oh, you're from Australia? Oh, very nice, cool. Come into my shop. Please sit down, have some tea. It's a very common experience, and this goes for a lot of countries. Russia is another great example. They don't really care. As a matter of fact, the moment they realize you're foreign, it's a matter of them simply trying to sit you down as fast as they can and ask you about your life and introduce you to their customs and their people and things like that. And the same goes for China as well. Once they realize you have a problem and they can help you, and once they realize that they can make a little bit of money off of you as well, all of a sudden, you've got the best friend for life. And the funny thing is, even if they are making money off of you, you're paying a fraction of the price of what you'd pay in the US. And you mentioned CAR T treatment, for example. In the US, that's often, $400,000, $600,000, right?
Oh my God, yeah. So expensive.
So the same treatment at comparable hospitals in China, like we're looking closer to $80,000, $100,000, $120,000. And I don't really care about your political affiliations or beliefs, but $100,000 versus $500,000 makes an awful lot of sense, especially when you've got cancer.
Yeah. Yeah. Oh my God, that is crazy. And thank you so much for bringing that up. It kind of makes you think like, man, I want to travel now and, explore the Chinese insurance companies and Russian. But it's true, because I'm pretty sure if the visit was the other way around to the US, we're so like, we're not welcoming. Like, we're just like, okay, schedule an appointment and we'll meet with you. Hey, make sure you catch us when we're on the office, or these are our business hours. We're just not as welcoming, which is unfortunate.
It's a completely different culture. I don't necessarily say I can agree with all of it. I don't think in China they even have business hours. Quite often I'm getting replies when it's like 3 a.m. their time and things like that. So on one hand, from the consumer or patient perspective, it's great. You're getting great round the clock service, but I got to feel sorry for some people because they're just working around the clock.
Wow. Well, that's crazy. So I want to go ahead and ask you something as we're nearing here to our closure of the podcast, but in our wonderful episode. But I want to talk about that elephant in the room. Yes, I'm going to go there. I want to end with this because your work also touches on healthcare policy, okay? And you even written like policy papers about Medicare. Sorry, about medical care and the importance of it. That's being reviewed in Washington D.C. today. That's a big deal. So let me ask you this. If Americans begin seeking more medical care, I don't know, like internationally, how might this reshape the US healthcare system? I mean, do you think is something down the road that could happen, like force change domestically? I'm just speaking here.
Well, it's a bit of a difficult one. You could say yes, and you could also say no. A good comparison would be this recent trend towards getting drugs in pharmaceutical, legal drugs from Canada. And that's been quite prevalent and prominent, and quite a few people have heard about it. And that was supposed to spur a lot of change within the US, to the point where quite a few new laws were proposed in different states regarding the pricing of drugs, because you would think that, or because there's competition, which is actually accessible to the average American, or at least in certain states, it's accessible. That would cause competition. But in reality, none of these laws regarding drug pricing have actually passed. There's nothing truly come out of it.
Wow.
But on the other hand, it wasn't necessarily big enough of a deal or a blip, you might say, to force change. And regarding what you were discussing with policy papers and things like that, there's been a recent shift. There was a lawsuit. I can't remember the name of the company right now, but there's now a legal precedent that self-funded insurance by employers, which makes up about, I think, 63% of health insurance in the US.
Wow.
That can now be liable to find treatment for their employees from overseas. Essentially, the argument being that if you have the option of treatment, which is significantly cheaper and of a comparable quality to what is available in the US, but at a significantly lower price, then it's not just your responsibility as an employer, but I guess a moral and legal responsibility as well to actually go ahead and make these things happen. And so now that there's a legal precedent in place, I think there might be a genuine shift towards looking elsewhere for healthcare. And of course, I want to believe that, given the nature of my business. But I think combined with quite a few other factors, that's going to become a reality. You can look at it from the perspective of how much people are actually getting paid, whether it is inflation constantly going up and real wages constantly going down, whether it is the political angle with a lot of people not just being fed up with the economic and political reality of the US, but also having that in combination with a new appreciation for other countries, not just China, but a new appreciation for other countries in general, being that you could say they respect their citizens a bit more. And so, with all of these different factors combined, it's reaching a melting point, you might say, of all of these different factors. And so when it comes to healthcare, I think we're on the precipice of some real change when it comes to the US.
That is awesome. And that's something that we all hope dear and near. Like, I hope that is coming soon to us because we need that. We need a change in healthcare big time. In comparison to other countries around the world, Adam, I'm going to hold on to that one very dear. I'm going to pray on it because we do need it. Adam, for our listeners out there that may be struggling, I mean, we may have listeners struggling with medical costs or navigating right now a complicated healthcare decision in their mind. What advice would you give someone who feels trapped by the system?
Well, as much as I run a business, the first thing I have to say to anyone in that situation is a patient advocate. That is perhaps the single most important thing that you can do, is to find yourself a patient advocate. And if you don't know what they are, essentially they're a navigator. They help you navigate the medical system, not just the actual the undergoing of medical treatments and things like that, but they understand the billing side of things as well. They understand which hospitals are perhaps prone to screwing you and which ones aren't.
Yeah.
And so I would say they're probably the first and most important port of call, because patient advocates, their job, their goal is to help you, to help reduce your bill and to help you get more effective treatment. So that's the first thing I would suggest doing. After that, if those options have been exhausted, then it's time to start looking for other options and treatments and things like that. And that's where Sylk Health comes in. We're simply there to give you an option. We're not there to say you've got to do it or anything like that. We're simply there to provide you an option, provide you a comparison with US prices and their prices overseas, and then allow you to make a consultation directly with the healthcare provider that you've selected within a few minutes. And so what we're really here to do is just help people.
Simple as that. And thank you so much for sharing that. And just to recap, just that major takeaway that I took from all of that, find yourself a patient advocate. Just find one. And it's true, Adam, what you say. And I convey to that. I know a particular friend of mine that does that for a living, and they do know their stuff. They will guide you and they're there for you. And I appreciate you bringing that up. I mean, Adam, overall, this has been a very just eye-opening conversation. I love this stuff because I feel like healthcare is something that just touches every family, like individually, very differently. And hearing new perspective on access, cost transparency. I mean, we talked about global options. I mean, all these conversations are very needed. We need to hear more. They're just very important. So, for listeners who want to learn more about Sylk Health and explore your platform, where can they find your work? Where can they find you and learn more?
Well, the easiest way to do it is to go to sylkhealth.com. The caveat being that that is Sylk with a Y, so SYLK health.com.
Thank you. I love the way you spelled it too. That's so awesome. I was like, how do you pronounce that? Sylk. SYLK Health. I love that. Thank you. Thank you. Thank you. Adam, this has been such a beautiful conversation. I want to thank you so much for joining me today, having this conversation with me, sharing your story, your insights. I really appreciate you coming in here and talking to us about the importance of healthcare cost transparency in Sylk Health. Thank you so much.
It's been an absolute pleasure. Thank you very much.
Of course. And to my listeners, thank you for spending this time with us. And if today's conversation, I always like to say, made you think, teach you something new, or even open your perspective a little bit, please take a moment and continue to follow my podcast, leave a review, and share this episode with someone who needs to hear this, somebody who's in the verge of seeking medical help. Find yourself a patient advocate. Go to Sylk Health. All these resources are right there for you. And like I always like to mention, all these conversations are great. These conversations remind us that sometimes the biggest changes start with simply just asking better questions. Con mucho amor, thank you for tuning in to Conversations with Iris. Thank you all. Thank you, Adam.
Thank you very much.